Hey everyone, Dr. Leigh here from Your Vet Online, and tonight we're going to be talking all about horses with colic. So if you've owned a horse and you've ever had a horse with colic, this is the chat to listen to, because basically we're going to go over exactly what colic is. We're going to go and talk about how we diagnose it, all the different types of colic, and basically all those things that you need to know so that your horses are kept nice and safe, and that you don't get into trouble there. Anyway, so I'm Dr. Leigh, and if you're just joining us now, we're going to be talking all about colic tonight. I know that it's everybody's nightmare, and whether you're a horse owner, whether you're a vet, whether you're a horse rider, or you just look after friends' ones, look, it's a shocking problem, and so I thought it would be a great topic to go over a few more things in depth. So make sure you say hello. If you have any questions, pop them in the comments just down underneath, and I'll answer them as we go. And yeah, so first of all, if anyone has had a horse that's had colic, pop in the comment section below, just say yes, and then it'll be a good idea for it will let everyone know just how common it actually is. The rest of tonight, the talk is all going to be on what the most common types of colic there are, and what you need to do as an owner to make sure that you're actually organised and can recognise the signs and do all the things that you need to do if this happens to your horse. So if you haven't met me before, I'm Dr. Leigh. I've been a vet now for about 18 years, and much of that time I've actually spent working with horses. I've been one of those vets that have been the one that's been called out to the paddock, called out to the stables in the middle of the night. I've also been the surgeon cutting the colics, and I've also been the anaesthetist trying to keep them alive while they're actually on the surgery table. So yeah, you could say I've had my fair share of colics, and yeah, I'm not saying that I'm an absolute expert at it, but yeah, you get a pretty good feel for what's going on when you've done as much work as I have. Now, if you're listening, make sure you say hi, pop your questions in the comment section, and I will attempt to answer them as we go through. And make sure you share this with lots of your friends, and we'll just show that they can learn something as well. All right, I see that we've got a couple of questions. Let me see, I'll just shimmy this. I'll just okay. This is Karen. I've never had an issue with colic, and why is that? Hey, it might be just luck. I would say you're just being very lucky, which is actually kind of cool. So yeah, look, it's not one of those things that anyone can predict. There's certain conditions that can predispose to colic, so we'll talk about that a little bit later. But I would say you've probably been just very, very lucky with everything. And Jasmine's got a question. My boy just recently colicked about a month ago, and it was one of the scariest things I've witnessed. It was such a slow and painful process for myself and my horse. Yeah, that's really sad, Jamaican. Yeah, colic is scary. It is really scary. So I can completely appreciate what you're saying there. Right. So let's get started then. What is colic? Okay, I guess we can all safely say that even just mentioning the word colic makes us all tremble in our boots, and we all get worried. So yeah, if you've had a horse with colic, just pop your name down with a yes in the comments area, so we can just get an idea. I see and a couple of other people have had their horses have had colics too, which is pretty scary. So what we do need to remember though is that the term colic is actually a generic term, and it's a generic term just for abdominal pain. So it describes what we call a clinical symptom, and it's not really a disease as such. Like, we wouldn't say it's like having, say, diabetes, or it's not like having Cushing's disease. It's actually a symptom. And so what that means is that there can be like heaps of causes of colic, and some of those can be very mild and don't really tend to cause too much concern, although they are painful, but they often just resolve and clear within a little bit of time. And then others are much more serious and basically an emergency. So it's one of those problems that can affect any horse, basically, and it is one of the reasons why so many horses die every single year. So it's absolutely crucial that you understand the subtle signs and what you need to do when you see those signs and what it might mean. So why don't we go and talk about what the signs are? So basically, you can have all extremes with some horses, and also with some horses you might have signs that are really mild, but actually they've got quite a serious condition going on. And then you have those horses who are violently symptomatic, and you really do know that they're very, very, very painful. So yeah, it's one of those things that sometimes the severity of the symptoms doesn't necessarily tie in with how severe the actual situation is. But I want you to all think about, if you're really astute and you know your horse well, and sometimes this can be very difficult if you don't see your horse very often, is some of the subtle signs that they might have colic or abdominal pain. It might be that they are just a little bit off their feed, or they're showing some disinterest in it. They might be licking their lips a little bit. Sometimes they curl their lips and they curl their tongue. Occasionally they'll look at their flank and just sort of give that little bit of a gaze, like, oh, it's something sore back there. And, you know, you have these horses that do the occasional paw, and, you know, things aren't too bad, but they're just a little bit restless. And it really depends on how bad that pain gets, because as the pain gets worse, or as the condition of your horse deteriorates, basically then we get more symptoms. So there's more pawing at the ground. They might lie down and they get up a lot. Some of these horses just lie down and just stay lying down for long periods. They might do a lot of stretching. I notice that some kind of what we call that dog sitting, sort of get their front legs out in front of them, and they sit back onto their haunches a little bit. And some of them try to go to the toilet quite a lot, and we call that posturing to urinate. Sometimes when the pain is really severe, or they've got certain types of colic, so the type of colic that springs to mind with this particular, when the pain is so bad, is a swim colic or a really bad gas colic, which we call a spasmodic colic. They can be horrifically painful and kick at their bellies, want to lie down all the time and get up and roll and thrash around. So it can be quite bad. But then other colics can be just as bad, you know, profuse sweating, all that rolling and thrashing about. Sometimes I've been called to see horses where the person's come in the afternoon to feed up, and they found their horse lather of sweat, grazes all over its head, where it's been thrashing its head into the ground because it's been in so much pain. And, you know, with the flared nostrils and the rapid breathing, heart rates are elevated. Although I must say I've had a few colics that have had quite low heart a low heart rate. So it can be a bit tricky. Heart rate can be a tricky one. But I guess the thing is, and I've got a little picture here, which I will try and find. Oh, hang on, where are we? This one here. So I want you guys to sort of take notice of this. If I get rid of my, what are the signs of colic? Hang on, let's see if I can get rid of that. Try and remove that. Yeah, so if you take a look at that, you'll see that these are all the vital signs that are absolutely normal. So these are the things I want you to learn about your horse. It's so important to know what normal is, because when you know what normal is, then you can tell what abnormal is, and then you can get help as you require it. So the big things for most horses, and I'm just reading off my screen here so I don't forget any of them, but anyway, the heart rate. Basically, most horses are average heart rate of about 40 beats per minute. So if they've been exercising or they're worked up and stressed, you can expect the heart rate to go up. If they're really cool and calm and collected, you can expect it sometimes to be lower than that. But 40 is a good sort of average number for most horses. Respiratory rates can vary quite a lot. Again, a horse in a paddock who's just chilling, doing nothing, or in his stable is going to be around 12 to 16. It's not going to be hard to breathe. He's not going to be gasping and trying to get the air in or out. So it's going to be about that. Now, temperature. Temperature is one of those things that I absolutely want you all to go and purchase yourselves a thermometer. It is the absolutely number one crucial thing to have in your kitty bag. Like, I really want you to get a thermometer, if I can just plead with you for that, because it is so important. It's such an important part of your medicine kit. Basically, it's the most important thing, I think, personally. But anyway, so your thermometer. So you want the temperature to be between 37.5 and 38.5. Now, I don't really get too concerned if I have a temperature, actually I've got 38.5. Usually I take it up to a little bit higher than that. So, you know, sort of 39, I don't have a problem with. Getting above that, I'm starting to get a little bit worried that there's something going on. So temperatures are a really, really important thing. Also, every day, just have a look at your horse's gum colour. Lift up their lips and just see what colour their gums are. They should be a nice pale pink. They should look just like our gums. If they are really white, if they're really horrible brick red, you know, like my colour of my top tonight, then you're in trouble. And if you've got lines that are sort of purpley and all that, yeah, not good. So gum colour is really, really important. So that's what we call mucous membranes. And if you push your finger into the gums and you count how long it takes for the colour to come back, usually it's about 2 to 3 seconds or so for the colour to come back, or 1 to 2 seconds, sorry, 2 to 3, 1 to 3, you know, around there. You'll get a feel for it and what's normal. If it takes ages to come back, we're really in trouble. So I want you to learn that, and basically, hopefully, it will, once you've recognize all those normal signs, then you'll actually be able to recognize the abnormal signs, because that's where we have to take action, is when we notice our horses playing up. So let's have a little look-see at, let me see, a little look-see at some of these questions. Okay, who have we got here? Here we have. Chris. Oh my gosh. My girl is rising 29 and she's had 3 colics in 15 months. Can it be age-related? Look, Chris, definitely. Older horses do tend to get what we call strangulating colics, so it's possible that she's got something in there, and it may be something like a lipoma. So it probably is, we don't really say age is a disease or anything like that, but there are things that as you get older, you find more prevalence. So lipomas are probably the big things. So I would, I would suspect that there's something going on there. Possibly even she may have some sort of stone in there. Yeah. Ultrasound is probably the thing for you to do with that. You'd probably need a specialist to help you with that. And it's possible that you won't find it either. So it's quite hard to diagnose the actual cause of that sort of thing. So yeah. Oh no, Amanda, many times the same horse. Oh, that's no good. Steve, no, but I feed oil and lots of roughage plus psyllium and paraffin monthly plus pumpkin worm. Yeah. Okay, so yeah, I must say I'm not really a fan of oil. There's lots and lots of studies to say that oil does nothing. So it helps you recognize that the feces are passing through, but it doesn't necessarily mean that it's actually doing anything. In fact, a really good experiment that you can all do, if you don't believe me that oil does not degrade poop, is to get some of your horse's poop. You want nice firm ones, and you want to put those in a bucket of water. So you have one bucket of water with the firm poop, one bucket of water, one bucket of paraffin with the firm poop, and you tell me and get back to me which one dissolves first. There you go. That's something that you guys can have a try and see what you can tell me in the next week or so. I bet you'll find that the one in the water dissolves first. Oh no, Jeannie. Yeah, lost a horse. Yeah, no, very sad. Sorry to hear that. Oh gosh. And Michaela's lost too. Oh no. Yeah, not good. And Rose, not mine, but one of our grazers, she was lucky when she got out a bit lethargic. Oh, that's good that she made a good recovery. Gosh, it seems like there's quite a few. Karen, we're not talking about puppies today, so we're available though anytime you want to talk to us. We have, we definitely are available, and you can go along to, I'll just pop the website up here. If you need to ask questions, you can go to the website yourvetonline.com, and we're available 24/7 for consults. So the consults that we have, we charge $49.95, and which is extremely reasonable when you think how much it does cost to get a vet out to you. So where are we up to? Let me think. Right. Oh, I have to get rid of that one. Oops. Hide. So I can put my other label up. And then, okay. So now that we've gone over the symptoms of colic, I really wanted to have a chat about some of the different types of colic, what actually causes colic. And we can sort of break this down into two different areas. We can either say that it's an abdominal cause of colic, or like a gastrointestinal cause, or it might be a non-gastrointestinal cause. So I've kind of lumped these sort of together. They're not completely, you might find some textbook will say something a different way. Hey, this is my version. So I hope you don't mind about that. But the first one is spasm, and probably that's the most common one that most people's horses, especially if they're out at grass, if they've had a swim colic, anything like that. And that's basically when the smooth muscle wall in the intestine just really, really contracts forcefully, and there's heaps of gas, like lots of gas formation. It's generally the colic that we get. So, you know, when you get a really sore tummy, that's often the type of colic we get. Well, it's the same with our horse. So it's extremely painful, but there's no blockage. There's just a very, very active and stretched intestine from so much gas. The second type I would talk about, I have to say, is probably the most common that we get around here and also in North America, is the obstruction. And that's basically when ingesta can't pass through the intestines, either because there's too much of it. So the horse has got a huge intestine, and basically it wraps around, and it's like goes all around, and it's got these big flexures and stuff. I should have actually had a picture of that for you. Might put that in a blog post for you, but so you can see how convoluted the intestine is. And so sometimes if there's a little bit of dehydration, or if there's foreign material like sand, or you might get parasites, or it's twisted, or anything like that, then you get an obstruction and ingesta can't pass through. The other thing that can happen is that we can have a strangulation, and this is where a blood supply is actually cut off because there's been a twist, or there might be parasites cutting off the blood supply and strangulating that area of bowel or omentum, so there's no blood supply to that actual tissue. And the other thing that can happen in the abdominal area cavity is inflammation. Now, this can be either of the body wall, so where we might call it peritonitis, or it could be of either the small intestines, where we call it enteritis, or of the large intestine, where we call it colitis. And basically, this is an inflammatory process. So those are all the sort of what I lump together as the gastrointestinal reasons for colic, but also we have some non-gastrointestinal or non-abdominal reasons that you might think your horse has colic, but actually it's something else. And those are things like laminitis, urinary tract infections, stones in the urinary bladder, sometimes a ruptured bladder, like we see this with foals. They can be extremely painful and they've got a ruptured bladder. We can see it with ovarian tumours, sometimes in the stallions. We see scrotal hernias. So those are sort of all those sort of things that they're a type of, they can be colicky, but it's not actually a primary abdominal problem. And when we look at all these different causes, some, as I sort of alluded to before, some can be very, very painful and you can pretty much get better very quickly or without too much intervention, while others require surgery or extensive medical therapy. So you can have the different types of colics can have different responses. Let's just see some more questions here. Let's see. Thanks, Renee. Karen's asking, should you walk a horse with signs of colic? Yeah, look, I don't think it's imperative to walk them. If they're standing still, or if they're lying down and they're just lying there and they're quite happy and they're still, then that's fine. Often when you have horses with colic, like a swim colic, you've got them out of the pool, and like racehorses often get this, you basically have to walk them because they're going to go down on you if you don't. So depending on how bad that colic is, really does just depend whether you walk them. Most of the colics that you see in horses stabled, out in the paddock, that sort of thing, you don't need to walk them. Even if the only time I do it is when they're absolutely going hardcore, wanting to thrash on the ground, and then you've got to be really careful that you aren't putting yourself at risk. So be very careful with those ones. Oh no, Jess, that doesn't sound good. Hope your pony's okay. Okay, Amanda, the lady with the older horse. Oh, okay, yeah. Okay. Amy's written a big thing here. Can a horse constantly standing still due to not ever leaving their round pail cause him to have an upset stomach such as runny poo? I've had it for a couple of months, but he's been on supplements, still has solid food, and we even took a not so great feed out of his diet, but he still seems to be. Oh look, that's a bit more than what this topic is about, Amy. So I'm glad you got the vet coming out. Look, it could be a number of things with that. So yeah, can't really go into too much depth here. If you did want to talk to us more about it, feel free to get in touch, yourvetonline.com. Okay, let's see. Okay, right, next thing. How do we tell that a colic is surgical? Yeah, because I think that's probably the scariest question for most people, because we all cringe and we think, oh God, how much is this going to cost us? And I hope we're not going to be, like our horse isn't going to be put under that. The big thing is that you really do need to have veterinary attention and assistance with most, just about all colics. Determining what actual type of colic it is does require an expert. Otherwise, we are pretty much guessing. The number one decision I would say as to whether a horse needs to go to surgery is its response to pain relief. So when we are looking at a horse who has colic, we usually do all our clinical exam and we give some pain relief, and while we're there, we're assessing how it's responding to that. Now, we also do some other tests, and these help us decide exactly what we think might be going on. So we might stomach tube the horse, and what we're doing there is we're looking for whether the horse has any reflux, and what that means is that because a horse can't vomit, when a horse's abdomen fills up with a lot of fluid, then you will end up having a lot of reflux in that stomach, and you've got to get it out somehow. Otherwise, yeah, it's bad news. The stomach can burst. So we stomach tube to do that, as well as to give medications and fluids. Your vet will also take its temperature, its pulse, respiration. Now, if a horse has a fever at a time when it's colicky, the likelihood of surgery goes down as a rule of thumb, because it could be, and I say could, it could be a case of inflammation of the abdominal contents, like the abdominal wall, as in a peritonitis, or it could be like a colitis or enteritis, as I said before. When we look at the colour of the horse's mucous membranes, if we see that they're brick red, if they're really nasty, that can mean that the horse is going into toxic shock. That does not necessarily mean that it needs surgery, because it could just be a horrific inflammatory process causing this, but it makes our risk of, trying to decide what's going on. Like if it's got a no fever and it's got those toxic looking lines, then it's likely to be something that requires surgery. You often find that lots of vets will do a rectal exam, and what we're doing there is we are feeling for the thickness of the bowel. We're also feeling to see if we can feel firmness. So if there's a big impaction of the pelvic flexure, when we put our hand in there, sometimes you just can't even get your hand very far at all because the impaction is so big. Sometimes you can feel small intestine loops of dilated intestine come back to hit you right there, and they're a smaller diameter bowel, and yeah, we know, oh, that's not good either. So basically we're looking for all those sorts of things when we do a rectal exam. We're looking to see if it, firm feces versus diarrhea, all that sort of stuff. And yeah, so it's the other thing that we often do is we do ultrasound, and sometimes it's a bit hard if you're out in the field and you've got a horse that's not being too happy about things, but basically allows us to look for things that we can't feel rectally. And for some, especially for foals, it can be really useful, and also trying to see whether we've got things like an intussusception or a nephrosplenic entrapment, where we've got the spleen, our intestine is hooked over the top of the spleen, it's in the wrong place, which it shouldn't be. And the other thing that you might have a vet do sometimes is abdominocentesis, and that's basically where we stick a little needle up into the abdomen, and we take out some fluid, and we take a look at that, and we have a look at the protein content, and we look to see how much what the lactate level is, and also check that we can't see any signs of rupture. So if we see bits of grass or anything in there, then it's all over Red Rover. That's not a good sign at all. So it sounds like a lot of things to do, but in essence, you can do it really quickly. Like a lot of vets can get all that done very quickly, because speed is of the essence with any of these things. If we think that the horse is in a bad way, we don't want to be mucking around. So we want to get that pain relief on board, and we want to see the response to it. Some of these horses, like I always refer back to these horses with spasmodic colics, often just a little bit of pain relief, and they feel better, and it just gives them enough to relax, and away they go, and they're all good. So let me see, what else have we got here? Who else is asking questions? Hayley, anything special to look out for in an aged mare, 26 years old, got a last up in great health by the looks of it? Look, yeah, so aged horses are a little bit more susceptible to strangulating colics. There's nothing special that you need to do. Literally, it's just keep your horse, feed it plenty of fibre, make sure that you're checking fecal egg counts so that your worming is on, you're worming appropriately and when you need to. And yeah, make sure that the teeth are looked after by a veterinary dentist. And yeah, there's nothing else that's really special. I guess the thing is, if you live in a sand area, so Perth regions, you try to avoid letting your horse eat off the ground. If with the whole sand thing, you might add psyllium to the diet with those guys. But really, making sure they're drinking. One thing that our North American friends often need to do, or people that live in really, really, really cold areas and the water freezes, is sometimes our horses get more colic because they don't like drinking really cold water. So if you're in an area where your water freezes, make sure that you check it often. And also, it's quite a good idea if you can especially if they're stabled, it makes it a little bit easier, but is to go around with the kettle in the morning and just pop some warmer water into the bucket, because that just warms up the water a little bit and it makes the horse drink. A lot of horses don't like, they just don't like cold water. What can we do to help a colicking horse while we wait for the vet to come? Okay, Jackie, we'll talk about that shortly. And young horses being more susceptible to colic or upset stomachs. As I said before, young, old, not really, not at all. So, I mean, yeah, unless you haven't been doing, you know, appropriate worming, appropriate teeth treatment, you're not feeding correctly, you know, too much grain, not enough fibre, that sort of thing, there should be no reason, if you've got good management, then there should be no reason for a horse to be any more susceptible to colic than any other horse. Yeah, they should be all on equal. Oh dear. Let me see. Okay. Can colic be seasonal? Yeah, kind of is. Often you do get more colic if it's really cold, because as I said, they don't drink as much. And also if it's dry, remember if they're eating off the ground and picking up lots of sand, that can cause issues too. So yeah, kind of can be seasonal if you want to think about it that way. But yeah, aside from those sorts of things, it's not really it's not really, you get more colics. And North America, when I worked up there, definitely we'd see more colics in the winter. And I am positive it was to do with not drinking enough. So we had a lot of impaction colics, which is really fun when you're doing surgery on those. There's a lot of shit. Yeah. Anyway, let's get on to how to treat colic. Now, back in the day, my grandfather used to always tell me, just give him a bottle of beer. Now, I do not want to hear that from anyone. I've actually been really surprised that I have actually seen people in Facebook groups say that. I tell you what, if I see that on my page that anyone's doing that, you'll be bollocked, because yeah, absolutely disgraceful. Pretty much there is no amount of beer is going to help a horse with colic. So the first thing that we're going to do is your vet will advise, look, I always want you to contact a vet, whether a vet actually comes out or whether they give you advice online, such as yourvetonline.com, or whether they give you a phone call or something like that. The first treatment we will often do is pretty much pain relief and or sedation, depending on what our clinical signs are and how violent that horse is showing those signs. So it's not something I want you to do yourselves without a consult with somebody, like with a vet, because you can get it very, very wrong if you don't have our advice. So you can hide symptoms. So it's definitely not something to do willy-nilly, even though you might think, oh, the vet just gives this and it's all sweet. Yeah, we do that because we've done an examination. We know the history and we know what's going on. So depending on what the problem is, the treatment can be very different. Well, it's not very different, but we have a different approach. So for things like our spasmodic colics, then we mainly just give them the pain relief, and we just keep them safe so that they aren't getting down and rolling and kicking at themselves, and we just keep them calm and quiet and pain-free. Look, sometimes the occasional spasmodic colic will go really bad, but the majority of them, it's just a time thing. It's just like us when we have those bad stomach cramps. You just got to wait it out and fart, basically. Yeah, that's pretty much what it is. So if your vet has decided that they're not quite sure what the cause of colic is, but it doesn't seem too bad, or they think it's an impaction colic, then the first line of treatment for those, well, the second line after giving pain relief, of course, is to start them on fluids. Now, we can either do that via stomach tube, or we can do IV fluids. It really depends on the facilities, the situation with the individual horses, and how bad they are. A lot of those colics work, they do very well with fluid given orally. So you might not need to even go IV. And often with those colics, you might even end up trying for a few days medically, but then need to do surgery at a later date. But the horses aren't ever in any great danger. It's not the emergency like other types of colics, such as strangulating colics, or the ones where there's a big twist or something like that. We often will put medications in the fluids. Sometimes those can help the gut move along a little bit better. Yeah, and if there's any sign of fever in a blood result, and blood tests have shown that there might be an infection, and it could be something that's completely unrelated, like an enteritis or colitis or something like that, we may use antibiotics. And again, it really depends on what type of colic it is and what the diagnostics we've used has shown, because we don't use antibiotics in very many colics at all. Sometimes we go to surgery after a few days, and sometimes we need to go to surgery straight away. So in those cases that are horrifically painful, we've decided all our signs, like we might have done the rectal, and we've discovered that, there's a big, you can feel the dilated loops of intestines, then we're saying, we're going to surgery. Often what we do is we prep the horse totally before we even put it under anesthesia. So we clip the belly, we scrub the belly, we do all that with the horse still standing and awake. And then that helps to shorten the length of our anesthesia time and helps with the whole period. It's less time on the table, and it's safer for the horses. I don't know. Actually, I've got some pictures here. Let's see if I can show you these. Why isn't this coming? Let me see. Move. Don't you hate it when you can't work the things? Oh, lovely, lovely, lovely. Get rid of this. I was just going to show you a picture, a couple of surgeries. Here's a picture of stomach tubing. Here I am stomach tubing a horse. So we do that. We're trying to get rid of any reflux that might be there. And in some cases, if the horse has got an impaction, we might actually be doing putting the fluids in. So yes, here we go. We can see that we've got there's a colic surgery here that looks like it's an impaction. They're going to open that one up and get rid of everything that's in there. And where's another one? Can't really remember what was going on with that one. Doesn't look like an impaction. Now this is a beautiful impaction. It's like what we call a fecalith. So really, really firm feces in that in that pelvic flexure there by the looks of it. So yeah, it's pretty grotty. So yeah, those are some pictures from different surgeries from around around the place. So yeah, so sometimes you do need to cut into the bowel and remove the feces that might be impacted in there. Sometimes we actually need to move a whole section of bowel, and that has issues all of its own. You might hear of some of the problems that some horses get, with adhesions and just really struggling after surgery, particularly with what we call ileus, where the intestines just stop. So instead of having that beautiful peristaltic wave that comes through, that pushes the fluids and the gut, the food through, the gut's just like stagnant. It just is like this. There's no movement. And so when that happens, then we're in trouble too. And so that's when we start to do more things like putting what we call lignocaine into the drips, into the fluids, and all that sort of stuff. So there's lots of stuff we can do there. But yeah, it's all quite complicated, really. Now, I know that you're all very interested in knowing what the prognosis of colic is in horses, and I wanted to have a little chat about that when it came, especially in relation to surgery, because a lot of people feel that surgery is really like the last thing that they should be doing. Now, the prognosis of colic really does depend on the type of colic, but also how quickly you intervene and make your clinical decisions and about therapy and whether you're going to go to surgery. One of the key things that I'd love you all to think about is, even if you are undecided on whether you're going to actually go ahead with surgery, it's far better to get your horse on the transporter and to a surgical facility so that you're not wasting valuable time if you do decide to go to surgery. Look, early decisions mean that the bowel itself, like the intestine, it might not be as compromised and require resection at all. So it might be just a case of untwisting it and it's all good to go, which has a lot less complications. Or it could be that you just have to milk the stuff through and away you go. But as soon as you start having to resect bowel, as soon as you're doing all that sort of stuff, you have more risks involved and you have more intensive medical treatments that are required. So the other thing that I just hear so often, and it's when people struggle to decide whether to have do surgery on their older or geriatric horses. Now, geriatric horses I'm calling 16 and older. Now, there have been quite a few studies, and I just wanted to mention this because it's really interesting. Basically, these older geriatric horses are more prone to strangulating lesions, and these will often require resection. But it's really interesting that as a group, the older horses did not have a worse prognosis for exactly the same surgery than did the younger horses. So, or, like mature horses. So horses that are 10, 12, that sort of age group. So I don't think it's a good idea necessarily to think of age as a reason to not do surgery on your horse. You need to make these decisions based on, can you afford it? So know exactly what your limit is right now, like have a chat tonight even, decide this horse, horse called Joe, I'm prepared to spend $5,000 on him on vet bills. The other horse, Brownie, I'm prepared to spend $10,000 on him. Every horse has got, you need to decide how much you're going to spend. You need to tell people, you need to tell everyone that's involved with that horse how much you're prepared to spend and the types of conditions that you're prepared to spend money on. It's one thing to say, I love my horse so much, but it's not feasible sometimes to do these things. So you've really got to make those tough decisions, and it's better to do that now when you're not in a stressed situation, because there's nothing worse when you're trying to think about money at the same time as thinking about, should I be going to surgery and should I be doing any of these things with your horse? Right, so that's my little spiel there. Now, your horse has colic. What now? So basically, if you notice a few little signs and you're a little bit worried, the first thing is assess how painful your horse is. If they are rolling and showing, really quite moderate signs of colic, then yeah, ring your vet or contact us, yourvetonline.com. Our vets are always available at 24/7, and we can help you through an exam. We can take a look even on video, assess things, talk to you about the history, and work out where to go from there. Often, some of these horses, we can give them something. You often will have stuff at home that you can give them, and things will be fine. But you need to get those instructions from your veterinarian, because unfortunately some of these things can actually mask signs. So you need to have that talk with the veterinarian so you know exactly what you're doing, when to do it, when to call, and what the process is. The biggest thing to do, I think, and I want as I said earlier, I want you all to get your thermometer, because I want you all to start taking your horse's temperature and to know what's normal. Because, yeah, knowing what your horse's normal temperature is can help with a lot of things. I also want you to make sure that your horse is safe and you yourself are safe, and you're not at risk of getting hurt when your horse has got colic. But if you can learn how to take their heart rate, learn how to take their respiratory rate and their temperature, and look at their colour of their gums, then you've got a lot of information that you can give your veterinarian, and that can help us decide exactly what we're going to do, whether a vet needs to come out immediately, whether we've got a little bit of time, whether we can just try a few things first at home. But basically, in all instances, you do need to talk with a vet. It doesn't necessarily mean you need one to come out immediately. The situations, you definitely just need to talk to someone and make sure the horse is safe. In essence, the quicker you can get veterinary advice, hopefully the better the outcome will be. Yeah. So I've just put our website details down below there. You'll see it at the bottom of the screen. And if you're ever in trouble, then yeah, you can contact us. Right, I'm just going to go through. There's a few comments. I'm just going to try and go back. We answered Haley there. Yeah, so Jackie, in answer to your question about what can we do to help a colicking horse while we're waiting for the vet to come, look, you need to do whatever you're going to do. You need to have the vet give you that advice. I can't give that. Like, there's no, as I said before, there's no general rule of thumb. Yes, you can do this. No, you can't do that. You actually still need a proper consult, and that's why having a service such as ourselves, where we can help you online, we can do it, take a video, we can see everything that you are seeing, so that we can work out exactly how bad that horse is and what the situation is, so that we can help you before your vet arrives, if they need to come at all. So while I can't give you exactly you need to do this or that, the big thing is take its temperature, do its heart rate, gums, all those sorts of things, so you know exactly what's going on and you can look for changes. And and you want to keep yourself safe and you want to keep your horse safe. So make sure no one's getting hurt by a horse leaping around and trying to thrash. I answered. Oh dear, what? My fella had bad compaction. He needed surgery, survived the zone, have it again to hospital for 2 weeks, but no surgery. Yeah, so as I said earlier, but it's probably related to his drinking and possibly the type of feed. So I would be looking into that a little bit. Yeah. Oh, yeah, that was that's what I reckon my grandfather thought. Yeah, not funny at the time though. Oh, that's good to hear that you're Valera. Hayley, I kind of, you say it's really expensive. I guess relative to humans, colic surgery is so cheap. And then relative to small animals, we're cheap again. So I think it's such a relative term that, like, horses are expensive themselves. So yeah. Let me see. Oh, Hayley, sorry to hear that your horse passed away. And Hayley, you're asking about at home like what? So basically what I was saying before, look, we can't tell you exactly what we would give you because we need to see what the horse is doing. So there's no way that we can sort of give that advice without seeing a situation. Right, let's see. My Welsh colt had colic 3 weeks ago, straight to scone, told him to treat, but operation wasn't an option. He pulled through. That's fantastic. I'm glad. Yay. And can worms cause colic? Yes, they can. Now, and that's what I was wondering about your fella, Hayley. I wonder if he was young. Just remember, everyone, ascarids, quite a nasty type of worm that can cause lots of issues, and often, especially in weanlings. Actually, what's the time of year? We're June. Yeah, so some of these weanlings, they're going to be, well, they're not really weanlings now. Well, some of them are. So make sure that you're getting your worming up to date properly for ascarids. Now, that's a really important thing. They are resistant. Ascarid worms are resistant to a lot of worm drenches. Actually, it'll be a good topic for me to have another, we might do a parasite talk, and we can discuss this a little bit further because, yeah, it's quite an involved thing. And, yeah, perfect timing. Hayley, at 8 months old, I would definitely be looking into thinking a little bit more about worms. I'd be getting him fecal egg counts happening and getting a program for him. So we can help you with that if you want to. Otherwise, so just contact us through yourvetonline.com, book a consult there, or you can get your regular vet to help you with that, because it's really important. These little guys, they are very prone to, as I said, ascarids, and sometimes the biggest, beautiful, most developed foal will drop dead. And yeah, it can be really frustrating. But anyways, hope, yes, I will do a worm talk. Definitely. Yeah, there's a lot of issues with worms and how we treat them now. So I think that would be a great idea for a talk. And yeah, I've got a little program which I do for I've got a little program that I do for parasites as well, which can take you through the whole year, so that we work hand in hand basically to handle your whole property. So anyways, I hope this was nice and helpful for everyone. I'm also put these up on YouTube and on our website. Make sure you give us a like and subscribe to our channels. And yeah, and basically, yeah, we'd love you to share with it as many people, and we're always available. We're 24/7 with consults that are Australian, $49.95. Yeah, and we'd love to talk to you next week. So I'm not sure what we're going to talk about next week, but make sure you tune in. We're here every Tuesday night, 7:30 p.m. Australian Eastern Standard Time. All right then, guys. I'm Dr. Leigh, and we'll see you next Tuesday. All right, catch you. Bye.